Hello everyone, welcome to Pediatrics by Dr. Ashok Nanda. Welcome to this series of pediatric MCQs. These are from number 181 to 190. To start with, all the following are components of a Levens criteria for cerebral palsy, except is it strabismus, is it hypotonia, is it abnormal posturing, it is seizure. Which one is the answer? Answer is seizure. Coming to the mnemonic, it can be remembered in terms of posture. P for posturing abnormal posture. O for oropharyngeal problems. S for strabismus. T for tone, that is increased or decreased tone. E for evolutionary responses, that is persistence, primitive reflexes, or failure to develop equilibrium and protective responses. R for reflexes, that is deep pulmonary reflexes are increased. So in this, seizure is not coming in that criteria. So the answer here is seizure. Second, extreme delta Bros pattern of EEG is seen in which condition? In which condition we will get extreme delta Bros pattern in EEG? Is it acute disseminated encephalomyelitis? Is it severe epileptic encephalomyelopathy? Is it anti-NMDR autoimmune encephalitis? Or it is a Dravet syndrome? The answer is it is anti-NMDR autoimmune encephalitis. These are the Bros pattern. You will get it anti-NMDR autoimmune encephalitis. So answer to this MCQ is your ADM. Sorry, anti-NMDR autoimmune encephalitis. Next, which of the following is the FDA-approved monoclonal antibody useful in RSV-associated acute bronchiolitis? Is it palivizumab? It is risebimab? It is carcebimab or indebimab? The answer is recently it has been the RSV monoclonal antibody nisebimab has been approved for use. To overcome the shortcomings of the palivizumab, there are some certain shortcomings, that is need of monthly dosing. There is logical issues, some cost related issues. To overcome that, a long acting molecule nisebimab was introduced. Indication, that is your preterm infants less than 32 weeks, where there is a risk of bronchopulmonary dysplasia. When the baby is less than 24 weeks with congenital heart disease and neuromuscular disorder, it is indicated to give monoclonal antibody nisebimab. Neonates and children up to 24 months are advised. Dose is 50 mg if weight is less than 5 kg, and it is 500 mg if weight is more than 5 kg. So the answer, the FDA approved recent molecule monoclonal antibody that is used is your nisebimab. Why in Down syndrome early onset of Alzheimer's disease is expected? Why there is association of early onset Alzheimer's disease in Down syndrome? The answer is it is because of the APP gene. The responsible gene is your APP gene that is being expressed in chromosome 21. As you know, Down syndrome is your trisomy 21, and the same APP gene it is being expressed in chromosome 21. That is the reason why in Down syndrome Alzheimer's disease is more common. Next, a 3-year-old child with high grade of fever for more than 5 days with strawberry tongue and rash suspected to be a case of incomplete Kawasaki disease. Which of the following tests shall not be included for evaluation? So it is a case of suspected incomplete Kawasaki disease. So among these 4 options, which one is not true? Is it serum albumin? Is it serum ferritin? Is it urinary WBC? Is it CBC? The answer is serum ferritin. Coming to the flow chart, evaluation of a suspected incomplete Kawasaki disease. When this child is having fever more than 5 days and 2 or more compatible clinical criteria, or infant with fever more than 7 days without any explanation, we will go for the laboratory test, the CRP and ESR. Suppose the CRP is less than 3, ESR is less than 40, then serial clinical and laboratory reevaluation is needed, and echocardiography if typical peeling develops, then that is the usual go. Suppose CRP is more than 3, ESR is more than 40 mm per hour, then we have to go for more tests, 3 or more laboratory findings, then that will be, we want to stamp this a case of incomplete Kawasaki disease. What are the lab investigation? That is what we want. We want anemia for that age. If platelet count is more than 4.5 lakh after 7th day of fever, or if albumin is less than 3, or there is a elevated ALT level, if WBC count is more than 50,000, 15,000, or if urine contains more than 10 WBC or high power field. If among these four, if 3 or more are there, or if there is a positive echocardiogram, then we'll stamp this as a case of, it could be a case of incomplete Kawasaki disease. So among these 6 laboratory criteria, serum ferritin is not there. So the answer to this question is serum ferritin. Gynecomastia in neonate is seen due to, what is the causative factor? Is it the maternal estrogen? Is it the maternal progesterone? Is it the GnRS? Or is it the gonadotropin? Which one is the culprit behind the gynecomastia in neonatal or mastalgia neonatorum? This is the mastalgia neonatorum, that the culprit is maternal estrogen. Syndrome shown in the picture is due to defect in which gene? This is the picture. What we will get? This is the globally called. What is the disease first? Then what is the syndrome first? Then what is the gene affected? The syndrome is your Pfeiffer syndrome, and what we are getting globally sepsis call. We are getting, in this case we will get syndactyly or brachycephaly and broad thumb. These are the findings what we will get in Pfeiffer syndrome, and the gene affected is your FGFR1 gene mutation. So the syndrome is your Pfeiffer syndrome, and gene affected is your FGFR1 gene. Second one phenomenon is associated with which glycogen storage disorder? There are certain clues in glycogen storage disorder. One question is, in which glycogen storage disorder will get second wind phenomenon? Is it von Gie's disease? Is it Anderson disease? Is it Markad's disease? Is it Cory's disease? The answer is Markad's disease. So following one episode of exercise, the patient become exhausted. Then when the patient become exhausted, then there occurs a second wind phenomenon. There will be more vascularity, more flow of blood to the muscles, releasing glycogen, leading to increase in capability to restart the exercise. That is called your second wind phenomenon. This is seen in Markad's disease, and Markad's disease is due to deficiency of muscle phosphorylase. So the answer is second wind phenomenon is, in which case we'll get in Markad's disease. Which of the following is a interleukin 6 inhibitor among these four? Tocilizumab, adalimumab, infliximab, or rituximab? The answer is tocilizumab. In tocilizumab is monoclonal antibody interleukin 6 inhibitor used to suppress cytokine storm as in COVID-19. Adalimumab and infliximab both are TNF alpha inhibitor used in rheumatoid arthritis. Rituximab is CD20 inhibitor used in B-cell NHL. So the answer to this question is your tocilizumab. Telephone receiver femur is seen in which condition? This is the typical telephone receiver femur. In which condition we will get this case? The answer is thanatophoric dysplasia. In thanatophoric dysplasia, we will get this X-ray. Will get telephone receivers femur. Babies born with type 1 variety are have very short lips, narrow chest, curved thigh bones, and flat spine, and rarely craniosynostosis. Thanatophoric dysplasia type 1 is more common than type 2. In type 2, babies born with type 2 have very short lips, a narrow chest, straight thigh bones, and joint in the skull that close too soon, and cause bulge at the front and side of the head. That is called your globally skull. It is due to mutation in FGFR3 gene that causes thanatophoric dysplasia. So answer, telephone receiver femur is seen in your thanatophoric dysplasia. Thank you. Please subscribe to this my channel, like and share. Thank you.